Obesity and aging form a dangerous alliance, one that quietly undermines cancer care, clogs the healthcare system, and threatens the well-being of millions of older adults. While both aging and obesity independently increase the risk of cancer, their combination creates a perfect storm of biological vulnerability, clinical complexity, and poor outcomes. And yet, this dual burden remains shockingly underrecognized in national health policy and clinical practice. As the population ages and obesity rates climb, more people are entering older adulthood not just overweight, but metabolically compromised. These individuals face a significantly higher risk of developing a range of cancers, including breast, colon, kidney, pancreatic, and endometrial. Aging cells are already more prone to DNA damage and impaired repair mechanisms. Add chronic low-grade inflammation from excess fat tissue, insulin resistance, and hormonal dysregulation, and the risk of malignancy accelerates sharply. But the threat doesn't stop at diagnosis. Older adults with obesity also tend to have worse cancer treatment outcomes. Surgery becomes riskier due to anesthetic complications, impaired wound healing, and higher infection rates. Radiation therapy is often less effective because excess adipose tissue alters dose distribution. Chemotherapy must be dosed cautiously, as obese individuals may have altered drug metabolism and are more likely to experience toxicity. Immunotherapy, a promising frontier in cancer care, also has uncertain effects in obese, elderly populations, where inflammation and immune dysfunction are already deeply entrenched. This intersection of obesity and aging also complicates long-term care strategies. Many older adults are managing not just cancer, but multiple comorbid conditions like type 2 diabetes, cardiovascular disease, and arthritis, conditions that are both caused and worsened by obesity. This creates a vicious cycle. Obesity raises cancer risk, cancer treatment becomes more complicated, and existing health problems make both prevention and recovery harder. The healthcare system is unprepared for this wave. Older obese adults are frequently underscreened for cancer due to stigma, mobility limitations, and clinical ageism, the assumption that age alone limits benefit from intervention. Physicians may hesitate to recommend aggressive treatment due to weight-related risks, even when such treatment is warranted. And after treatment, obesity often limits physical rehabilitation, increasing the risk of frailty, falls, and permanent disability. Caregivers are also burdened. Obese older adults often require specialized equipment, more assistance with mobility, and intensive dietary management. These needs are rarely met, particularly in underfunded nursing homes or home care settings where time and resources are stretched thin. And what of prevention? For older adults already facing metabolic dysfunction and limited mobility, losing weight is difficult, if not unrealistic. Yet weight maintenance, or even modest loss, can still improve inflammation markers and lower cancer risk. Unfortunately, few programs exist that are tailored to the physical and psychological needs of older adults. Most community weight loss initiatives focus on younger demographics, ignoring the nuanced realities of aging bodies, cognitive decline, medication interactions, and social isolation. The sad reality is that older adults with obesity fall into a policy blind spot. They're too old to be targeted by most obesity prevention campaigns and too overweight to be served well by a healthcare system not designed to manage their complexity. They are quietly written off, expected to fade into the background with their chronic diseases until cancer emerges, and often, by then, it's too late. If we don't act now, this double burden will break the system. It will flood oncology clinics with high-risk patients who can't tolerate treatment, drain Medicare and Medicaid budgets, and increase mortality in a population that deserves better care in the final decades of life. It's time to stop pretending that aging and obesity are separate issues. They are converging into one of the most urgent cancer threats of the century. And unless we redesign healthcare, prevention, and policy with this in mind, older adults will continue to bear the heaviest weight of our failure to act.